Hey everybody, it's Dr. Osborne. So we're going to talk about how to change a diaper to prevent a colicky baby. So could 99% of you, the people that are changing diapers, be doing it wrong? I mean, it's dumbfounding to learn that by pulling a baby's legs up with one hand, it could actually be causing nerve interference and possibly leading to colic in infants. See, I'll never forget the moment when I realized that as a chiropractor and as a parent, I've been really messing something up, and that was my child. I wasn't a newbie by any means. I've been in a family practice for 3 years at this point and served my profession at the state and the national level, and had already won multiple awards. But there I was, changing my daughter's diaper, and I was dumbfounded. Most of us do the double leg lift, right? We lift our kids up. Well, let me explain. There's another way. Almost all of us also do the sniff, undo the diaper, lift the baby up by the legs, they get the dirty out, and then we wipe the creases, insert the new one, and a couple of swipes with the tape on the side or Velcro or snaps or pins, and it's all done. And it's the way we've seen it done in the movies and on TV and our own living rooms for generations. It's even rational once the new babies discover their feet, it's almost impossible to keep them out of their mouths. But I'll tell you this, the way most of us have intuitively changed a diaper is not sound biomechanics, it's spinal biomechanics. And it's very well that might be the cause of your baby's colic. And that's where the face to palm movement came to me. As a chiropractor in family practice, I've seen plenty of colicky babies. And there's plenty of research on it, and have witnessed pretty impressive results. One study actually showed that adjustments were more effective than medication for colic, and another showed a 93% success rate in helping children with the symptoms of gas and bloating and pain. Well, we understand that the intestines get a large portion of their nerve information from the area of the spine near the bottom of the rib cage and the upper portion of the lower back. It's one of the areas we check when a parent brings their child in with colic symptoms, because interference to that flow keeps the intestines from functioning properly. See, if the area is being interfered with or subluxated, then adjustments can help restore normal nerve function and allow the body to actually heal itself. See, the reason that chiropractic works so well for babies is that it deals directly with the nervous system, and that's the system running the whole show. See, I've been doing this in practice for years, but I was missing something pretty important. When we're born, we have one spinal curve. It's the fetal curve. It's in the fetal position, the C-shaped curve of our middle back that is necessary to stay tucked nice and snugly into that womb. But the primary curve is the only curve we have as an infant until we build up the other two curves in our spine. The first reshaping of the cervical curve happens in our necks when we learn to lift our bobbly heads up and we hold them up. And then the second curve, called the lumbar curve, happens in the low back, and it forms when we learn to crawl. See, we need these secondary curves to support our body weight for standing and bending and lifting, but until we build them, the mechanics of the spine function very differently. So if you think of a baby spine like a bridge, one that doesn't have a cervical or lumbar curve, then the peak of the bridge is right between the 9th and the 11th vertebra in the thoracic spine. And to give you an idea of where that is on you, the ribs that actually make up your rib cage exit at the 8th thoracic vertebra, and the floater ribs, those like half ribs at the bottom, exit from the 9th and the 12th vertebra. So compare that to where an adult's peak is, and that's right between the shoulder blades. And what you're going to do is you're going to come to the same realization that I did. If you're hunched over a lot, and you're working on a laptop or driving for too long, and people are starting to feel tightness in their middle back as the vertebrae start creeping backwards out of position. The more you do it, the sorer it gets. And in a way, this is exactly what's going on with our babies when we raise their legs over and over and over again, just by lifting them up. A lot of parents do this without realizing that they're actually causing subluxations and nerve interference that will actually result in colic. I see it in the office all the time. Yet, until this moment, I really had no idea that I kept seeing the same colicky kids over and over again. See, the double leg lift is pretty intuitive, so I don't blame us for thinking that it was the right way to do it. Infants are but I want to help you do it. Infants are folded inside their mom, and once they discover their feet, it's impossible to keep them out of their mouths. But the difference in the bending is now at the hip joints. The femur heads in infants are barely developed because they don't need the bony structure for standing or for the muscle strength or the tension that they would usually have for walking. What that does, it lets them fling their feet up over their heads and giggle without even thinking about it. But when we use those legs as handles for a child who doesn't have any secondary lumbar curve, what we're doing is we're folding the spine at its peak. We're pushing the vertebra out of place where the nerve flow for the intestines to come out. And we're doing this how many times? 3 times a day, 5 times a day, 7 times a day. No wonder chiropractic has had such a high success rate with colicky babies. We just put back what our parents keep putting out. We need to break this cycle for everyone's sanity. And this is why I advocate the roll technique for for changing a baby's diapers, especially ones that haven't started crawling yet. Have you noticed that most babies crawl with a curve in their low back? Those are the ones, and they don't have colic. It takes a little practice, but after a few days, you're going to get used to it. Holding the baby by their chest and actually just rolling them on their spine keeps their spine in alignment, and it's going to help them hold their adjustments so much better. Then you can wipe, roll them back over, wipe again, and then put the diaper in there, roll them back over, and then put the diaper out. Look, I'm a parent just like you. We're learning as we go along the way, but what I want to make sure that you do is you have all the tools necessary to give your children the best chance at a healthy and long life. So this week I want to encourage you on Thursday. We're actually having a healthy children's webinar coming up here, and it's actually going to be hosted by Dr. Sherry and Cheryl Mestez, who's a crunchy mom extraordinaire. She's one of the best moms that I know. And so below you're going to find the link to that. I'm going to suggest that if you like this video, make sure you watch this webinar, because you're going to learn other things like that will change how you parent and will change the lives of your children. Make it a great day.